Hello, my name is Cassandra Jones, and I'll be talking about conflictions between visual and somatosensory areas. I'll be talking about three different types of illusions that are conflicts, starting off with the rubber hand illusion. This is an illusion where your hand is hidden from your view, and instead you see a rubber hand. An example of this illusion is when another person will use a feather on both your hand and the rubber hand. Once that action is stopped on your actual hand, you will still feel somatosensory activations because your viewing is still happening to the rubber hand, and you adopt that hand as your own, as seen in the picture on the right. You can even feel pain during this illusion by hurting the rubber hand after you feel like it is your own hand. This takes place in both visual and somatosensory areas of the brain, and it's a confliction of the two since you see that it's not your hand, but you still feel as if it is. It is also a product of mirror neurons, which are neurons that are triggered when you witness someone else doing a motor action. In a study done by Wasaka and Kakiji in 2012 about conflict in sensations between left and right hands when one is hidden from you, it showed that when one hand is mirrored, participants feel sensations in both hands, even though only one hand is being actively stimulated. Here is a video showing how the rubber hand illusion works.
Clearly no, then she'll stop, but you continue to...
And here is one of the experiments. Real hand, fake rubber hand on top. 2 minutes stroking both hands while I focus on the rubber one. Very fake looking syringe plunging into the fake hand. The human brain, it seems, is a very strange thing.
One of the important things that we're looking at in a laboratory at the moment are strange experiences or hallucinations, and particularly anomalous body experiences. And a classic example of this that everyone has heard of is the out-of-body experience. And we want to explore the real brain basis of these experiences.
And doing that involves experiments like this one. Now, traditionally, my response to this sort of experiment will be measured using a questionnaire. But the aim here is to use electrodes and sensors and get much more accurate, in-depth data.
What we're finding in the lab at the moment is that people that have out-of-body experiences and other anomalous body experiences give very different responses to other people who don't report any of these experiences. So they do look different in these signals.
I've never had an out-of-body experience, so I'm no use for these experiments, which is just as well, as clearly my brain is very easily fooled by large plastic syringes. Seriously, this is take 2. So apart from torturing me, why do this?
We now know the brain can throw out-of-body experiences as a kind of stress response. And so understanding how and why and the contexts of why the brain reacts in this way is very important.
And it's such a shame I can't help with any further research. David Gregory Kumar, BBC Minutes Today, Birmingham.
I thought this was really interesting because they hypothesized and were testing if the rubber hand illusion can have less of an effect on people who have a lot of out-of-body experiences, and they found evidence that it did. So circling back to mirror neurons, they trigger from observing other people performing an action. They are a conflict of visual and somatosensory areas since you're not performing the action, but the neurons are firing as if you are performing that action. But what happens when you can't see? Like, for instance, blind people. How do the mirror neurons work? A study done by Ricciardi and his colleagues in 2009 showed how the mirror system works in blind people. They used 8 blind subjects and showed them auditory stimuli. The results showed that the mirror system in blind people is based on sensory representations of actions instead of visual sightings of these actions. In other words, they process information of motor actions that are not visual, like auditory cues. They also found that they had a stronger response to familiar sounds than unfamiliar sounds. Lastly, a lot of the activity when hearing the sounds happened in the extrastriate visual cortex, which specializes in the shape, movement, and localization of objects. In a meta-analysis done by Thompson and his colleagues, they found that mirror neuron brain regions are more for identifying actions instead of intentions, particularly in the inferior frontal gyrus. This further goes into how the mirror system works within blind people, since they can use sensory representations to interpret actions, but it's harder to sense out intentions, especially if you can't see what they're doing in their body language. The second illusion I will be talking about is the monkey hand illusion. It is similar to the rubber hand illusion, but instead of using a rubber hand, it uses a fake monkey hand. This is to compare if we have the same activations to something so obviously not our own hand, as you can see in the picture on the left. In a meta-analysis done by Preston and Kirk, the first experiment they talked about compared children versus adults doing different tasks with the monkey hand and the rubber hand illusion. The results showed that children have more flexible body representations and it decreases with age. Additionally, it showed that our cognitive knowledge changes our sensory body experiences. A reason why children's body representations could be so flexible is because of neuroplasticity. Neuroplasticity is how much your brain can change and is highest when you're younger. It can allow children to think and see things more subjectively and view things in a different way that isn't necessarily sensible. The third illusion I will be talking about is the phantom limb illusion. This is an illusion where when someone has a limb removed, it feels like it is still there. A part of this is cortical reorganization. This is when neurons that used to respond to the missing limb now respond to signals from nearby neurons, the place the limb was connected to. This is associated with phantom sensations, which is when they feel the loss of the limb and it can cause physical pain. The difference between this and the rubber hand illusion is that in the rubber hand illusion, you still have the limb, but you feel sensory activations from looking at a similar limb. So, how does the phantom limb illusion help amputees? Well, there are about 1 in 190 Americans that are amputees, and this may double by 1950 according to Ziegler Graham and his colleagues, making it 1 in 80. Amputees can use the illusion to assimilate into their new lifestyle. In a meta-analysis done by Castro and his colleagues in 2023, they found that the phantom limb illusion, in regards to the rubber hand illusion paradigm, helps amputees gain ownership of their prosthetics. They also found that it can help future research by developing more sensory-based prosthetics to make it easier for amputees. Going into a case study that combined these two illusions, done by Yoshimura and his colleagues, who used virtual reality training to treat phantom limb pain. It was done on a 42-year-old woman who had 4 of her fingers amputated on her right hand, 9 years prior to this case study due to a work incident. She had reported severe pain in the palm of her hand and could not use her hand because of how much it hurt. She also tried alternative methods before the study, including mirror therapy, which is mirroring the left hand to look like it's her right hand, as seen in the study done by Wasaka and Kakiji. In the study, she didn't use virtual reality training for 4 weeks, but then used it for 10 weeks, without for 8 weeks, and with it for another 10 weeks, making it a 32-week study. As you can see in this picture, she used the virtual reality training to use a virtual hand, with all of her fingers that were amputated, to conduct the simple task of picking up a ball. The results showed that virtual reality training reduced the pain in her amputated limbs and improved her upper limb activity, allowing her to use her hand in daily activities. It helped her recover from phantom sensations, especially since it had a high sense of immersion since the controller would vibrate when picking up the ball. There was also the incorporation of the phantom limb illusion, which helped cope with the loss of the limb by making it look like the limb was still there. The patient reported an increase in motion and speed of the limb in daily activities such as cooking and washing clothes. Lastly, they mentioned that future studies should look at higher level amputations, particularly of the arm and the forearm. In conclusion, there are multiple conflicts in visual and somatosensory areas, particularly in the rubber hand, monkey hand, and the phantom limb illusion. However, some of these conflicts can help amputees cope and recover with the loss of a limb. And then here are some of my references for further information. And here are some of the images in the video citation that were not included in the other references. Thank you so much for listening.